Dr. Vikki Petersen here. I live in Silicon Valley, that's where my clinic is, and I do a lot of lecturing to Silicon Valley corporations in the area. And today I was lecturing about how to stay healthy living in a toxic world. And it struck me as I was reviewing a particular chemical in our environment that this was something I really wanted to share in this forum. So what I was talking about, one of the chemicals and drugs that I was talking about was acetaminophen or Tylenol. Now, Tylenol is one of the most common, not only in the U.S. but worldwide, analgesics, meaning it helps for pain, and antipyretics, meaning it decreases a fever if you have one. So it's the most commonly used drug for that, as I mentioned, in the U.S. as well as worldwide. So this is something that's very, very present in our environment. It's available for children. There's even an infant formula, and it's been obviously on the market for a very long time. What has been discovered, and it's been coming out kind of slowly over a long period of time, but last year the FDA came out and said they were really considering lowering the dose of the allowed amount of Tylenol on the label, because even at the recommended daily amount they were seeing a huge incidence of liver failure. So of all the cases of liver failure, at least in the U.S., it's estimated about 25% of them are due to people taking Tylenol at the prescribed amount. The other 25%, so of half of the liver failure cases, 50% are due to Tylenol, but half of those are due to people that overdose intentionally and actually trying to commit suicide. So it's used for that. But of that 50% all Tylenol related, half of those, or 25% of the total, are from people innocently taking this analgesic for pain, taking it correctly, and not abusing it. And that's at about 4,000 milligrams per day is the intended dose. So what has been discovered is that taking this dose over a period of time becomes very toxic to the system. What happens is it overwhelms the body's ability to kind of gobble up the toxin and handle it at the time. Many toxins are, as I'm about to describe, which is that when they enter the liver, there's two stages that the liver goes through to detoxify something. And for some more dangerous substances, after the first phase, or phase 1 of liver detoxification, the metabolite, or the substance that's in a partially broken down state, is actually more toxic than the original substance. And Tylenol is one of those substances. So if the liver is a little overburdened, or the body's a bit overburdened with toxins from Tylenol for too long, from other sources, then those phases of phase 1 and phase 2 that should happen very quickly, what happens is phase 1 occurs, and then you have this substance that's more toxic than the original, and then phase 2 doesn't happen fast enough, and then that more toxic substance causes damage to the liver, kidney, other places as well. Lung conditions are very, very common side effects with Tylenol toxicity as well. But the liver is the leading cause. And what sprung to mind as far as my gluten-free audience is that with celiac disease, there's an 8 times increased risk of mortality from liver cirrhosis than for the general public. So 8 times is a tremendous increase. So those with gluten sensitivity, gluten intolerance, celiac disease, who are not mindful of their diet, who haven't been diagnosed yet, which is certainly the greater number, these people, because of the gluten sensitivity, are already at tremendous risk for their liver. So imagine that person then on top of it using Tylenol for pains or aches or headaches or what have you. They are at a tremendously large risk, even more than the general population. So I think this is important for everyone to know about Tylenol. It's definitely something you can research very easily. The information is out there. I'm sure the makers of Tylenol are not terribly anxious for people to find out, but this information is out there. The FDA is looking into diminishing the dose because of this horrible side effect, but it's important that you know, it's important that you tell others that you know who use this of the dangers. And I think it's equally important, adults, children, but if you get in the habit, if this is something you tend to do, it's going to accrue, it's going to bioaccumulate, which means it's adding up more and more in your tissues, and what it does is it counters the body's ability naturally to make an antioxidant called glutathione, and antioxidants are the things that quench or gobble up those toxins. So you want a lot of them, and what Tylenol does is it diminishes your reserves, so it puts you at risk. So I hope this was informational for you. Please take it to heart, share it with others, and until next time, I wish you very good health.